If you are someone who experiences dental claustrophobia, you know how much pain you have to be in before you actually go to the dentist to have a procedure. Maybe you have tooth sensitivity or an infection, maybe you even need a gum graft. It can be a very overwhelming experience, especially if you have that terror of having that claustrophobic reaction to sitting in that dental chair. A lot of this can be because there's a lamp right over your face. You have people's hands over your face inside your mouth. You might even have to experience that rubber dam that they put in when you're having a cavity filled. Now, this is going to be an experience where you feel like you are trapped in the chair. You might even be white knuckled holding on to the armrests while they're actually working on you because you don't know when it's going to hurt or when you can actually escape that situation. Now, you know that you're not in danger, but your brain is telling you that you are. And of course, it is not pleasant to feel like you are trapped or restrained to a chair where somebody's actually working right on your face and inside of your mouth. And a lot of people also find that it's very difficult to breathe, and then you have the panic attacks because you feel like your airway is not actually free moving and you can actually get a lot of oxygen. So, again, this is where that panic can really set in. So, the fear, fight, or flight response is going to be pouncing on you from that primitive part of the brain, and it's going to take over to try and protect you and make you want to flee right out of that dental office. And what's going to happen is you're going to start avoiding those procedures and those treatments until the pain that you're experiencing gets too much to bear. And then, unfortunately, you might have a long waiting period in order to actually have that procedure done. So, if you are experiencing this kind of terror or claustrophobia around a dental procedure, the nice thing about hypnosis is that we can actually correct that fear, fight, or flight response and bring that down to a very manageable level where you can actually confidently and calmly go through with your procedures and have the dignity that you want to have in order to get through the procedure as calmly as you can. And you are the one that's actually in control and not somebody else being in control of you sitting in that chair.